Medical Assistant Practice Test 2023 100 questions with explained answer. Centesis refers to puncture. Word part that means excision is ectomy. The term that means suturing of the heart is cardiorrhaphy. Excessive tissue formation is referred to as hyperplasia. The word part meaning white is leuco. Erythema means red skin. The word part phago means to eat. Laparotomy referring to incision into the abdomen. The abbreviation for urine is The opposite of superficial is deep. The term gastroscopy refers to the process of viewing the stomach. The word nephro means kidney. Pyelolithotomy is a term that refers to an incision into the renal pelvis for removal of calculi. One who studies cells is a cytologist. What is an electrocardiograph? A device to monitor electrical heart activity. The word part that means heart is sero. What does a histologist study? Microscopic tissue. The incision into the chest wall is called thoracotomy. Term meaning vein is intravenous. The word part meaning megalo, large. A term meaning to cut into the tube from the kidney to the bladder is ureterotomy. Term meaning under the skin is hypodermic. Afferent refers to conducting toward. Neoplasm refers to new growth. Atriomegaly refers to an enlargement of the atrium of the heart. The word part stetho means chest. Iron-containing pigment is called hemoglobin. One complete heartbeat combining the contraction and relaxation phases is known as the cardiac cycle. Angio refers to vessel. Necroscopy refers to autopsy. Reno is a word meaning kidney. Cancer or malignant rumors are referred to as sarcoma and carcinoma. Metaplasia is a term which means change in tissue. The suffix which means incision is otomy. The suffix which means plastic repair is oplasty. The term self refers to auto. Physiology is the study of the function of living organisms. An instrument used to view the nose is a rhinoscope. Prognosis refers to prediction of an outcome. Resection is a term which means to cut or remove a portion of. The suffix which means discharge or flow is orhia. Excision refers to the act of removing. The suffix which means pain is algia. An instrument to cut is a tome. The combining for woman is ginkgo. The suffix seal means hernia. The term chronic indicates the duration of a condition. The medical name for nosebleed is epistaxis. The abbreviation for blood pressure is BP. Another term for subcutaneous injection is hypodermic. In the word hemoglobin, the word globin means protein. The medical prefix for eye is ophthalmo. The medical prefix for joint is arthro. The word part meaning female is ginkgo. The word part meaning heart is cardio. The word part meaning producing is geno. The word part meaning nerve is neuro. The word part meaning intestine is intero. The prefix meaning nose is rhino. The word part meaning bone is osteo. The word part meaning brain is cerebro. The word part meaning cell is cyto. The word part meaning examination is scope. The word part meaning to cut is section. The word part meaning nature is physio. The word part meaning life is bio. The word part meaning kidney is nephro. The word part for blood is hemo. The word part for disease is patho. The word part for skin is dermo. The word part for stomach is gastro. The word part for gland is adeno. The word part for head is cephalo. The word part for mass or tumor is onco. The word part meaning knowledge is noso. The word part meaning mental is psycho. The word part meaning ear is odo. The word part meaning neck is cervico. The word part meaning eyelid is blepharo. The word part meaning male is andro. The word part meaning lip is chilo. The word part meaning hand is chiro. The word part meaning rib is costo. The word part meaning skull is cranio. The word part meaning bladder is cysto. The word part meaning tear is dacryo. The word part meaning finger or toe is dactylo. The word part meaning sweet is glyco. The word part meaning liver is hepato. The word part meaning uterus is metro. Prefix a and means without, ana. Up. An instrument used to examine the ears. Otoscope. Social history includes the marital status. Which of the following occurs as a urine specimen remains on the counter for a long time? Bacteria multiply. A Holter monitor measures heart rhythm. The nerve most apt to be affected during an injection in the buttock is the sciatic. An injection into fatty tissue lying immediately under the skin is called subcutaneous. The first and most important rule to remember in an emergency is to stay calm. Medical assistants are expected to make decisions in medical office emergencies based on their medical knowledge. A surface free of contaminated instruments. Sterile field. Gloves, masks, and gowns are known as person protective equipment. Washing instruments to remove debris. Sanitization. Absence of bacteria. Asepsis. Bacteria that thrive in oxygen. Aerobes. An organism that produces disease. Pathogen. Molds and yeasts are types of fungi. Instruments touched by and gloved hands are contaminated. Destruction of all microorganisms. Sterilization. How should hinged instruments be when sterilized? Open. A sterile pack containing scissors, thumb forceps and gauze squares is called a suture removal pack. The term for removal of contaminated materials from a wound is debridement. Scrubbing the surgical site in a circular motion from the center, the edges. Surgical prep. Removing fluids or gases by suction is called aspiration. Flushing out a wound or cavity with a solution is called irrigation. A sterile surface containing sterile items is a surgical tray. SBNBB describe surgical scissors. Instruments used to clamp off blood vessels are called hemostats. A sterile covering placed over a wound is called a dressing. Instruments such as fiber optic scopes are soaked in chemicals in a procedure called cold sterilization. Pulse located at the elbow. Brachioal. Pulse located on the knee. Popliteal. Pulse located at the thumb side of the wrist. Radial. Pulse located at the side of the neck. Carotid. Pulse located in the middle of the groin. Femoral. The highest reading of blood pressure is called systolic. Blood pressure measured while patient is lying, sitting, or standing. Orthostatic. An instrument used to test reflexes is percussion hammer. An instrument used to open a body orifice for viewing is speculum. An instrument used to examine the eye is ophthalmoscope. An instrument used to examine the ear is otoscope. An instrument used to examine the rectum and colon is sigmoidoscope. Irregular heart rhythm, rhythmia. Rapid pulse, tachycardia, having no symptoms. Asymptomatic, slow pulse, bradycardia. Material status is considered social history. The patient's own words determine the chief complaint. Family history is considered subjective. The physician's physical examination is considered objective. Physical, chemical, and microscopic examinations are urinalysis, a chemical substance that prevents clotting of blood in a blood specimen. Heparin, a vacutainer that contains no anticoagulant, has a stopper color red. Material that presents a risk of possible infection. Biological hazard. The first step in preparing a laboratory specimen. Patient identification. The usual site for capillary testing is fingertips. Urine specimen obtained by the patient simply urinating in a cup is called random catch. Patient is instructed to cleanse the urethra with an antiseptic toilet is a clean catch. Legal method of documenting lab testing process security. Chain of custody. A sterile swab would be used for a wound culture. The intensity of color in a urine specimen indicates concentration. Improper handling of lab specimens can result in contamination. Instrument used to prepare urine or microscopic examination is centrifuge. The standard EKG consists of how many leads? 12. Simple laboratory test with a high degree of accuracy. Wave test. Quality control in the laboratory ensures what kind of results? Accuracy. Stool specimens are tested for occult blood. A machine used for testing lung capacity. Spirometer. Tuberculosis can be diagnosed from a sputum specimen. Patient begins urinating in the toilet and catches the remainder in the cup is a midstream catch. A physician orders 1500 mcg of vitamin B12. You have 1000 mcg ml on hand. How many milliliters will you give? 1.50. A physician orders 10 milligrams of compassine. You have 5 milligrams per milliliter on hand. How many milliliters will you give? 2 milliliters. A subcutaneous injection is given at an angle of 45 to 90. The most used deep adult intramuscular injection site is the dorsogluteal. When administering a subcutaneous injection, the amount of the dose should not exceed 2 cc. When choosing a needle, syringe you should keep in mind the patient's age and size. The gauge of a needle is determined by the diameter of its lumen. A physician orders 0.250 milligrams of lanoxin. You have 0.1 to 5 milligrams tablets on hand. How many tablets will be given to? What is the preferred site for a tuberculin skin test? Anterior forearm. The proper way to express half a cc is 0.5 cc. An injection into fatty tissue lying immediately under the skin is called subcutaneous. Medication given PO is administered orally. An ampule contains how many doses? 1. Antitussive medications are used to control coughing. All procedures during a medical emergency must be documented. The first technique to use to control bleeding is direct pressure. Poorly reacting pupils might indicate a severe head injury. A piece of emergency equipment is to re-establish normal heart rhythm. Defibrillator. The first thing a medical assistant should do in an emergency situation is assess the situation. Equipment prepared in advance for emergency use is called a crash cart. A basic CPR is to clear the airway. The lack of a pulse is one way to identify cardiac arrest. A straight fracture across the bone shaft is called a transverse. A weak and rapid pulse is a sign of shock. A severe involuntary contraction of muscles is called a seizure. An overdose of insulin would cause the patient to go into diabetic shock. Nitroglycerin is ordered for chest pain. It will be administered under the tongue. Formation of blisters following a burn can be treated with cool water. An emergency tray would include epinephrine. To establish an airway, the patient would be places on the back. Symptoms of heart attack including pain in the chest, jaw or arm. The procedure used for a choking person is Heimlich maneuver. A broken bone wedged into another bone is called an impacted fracture. A patient who is having a seizure should never be restrained. What are the ABCs of emergency care? Airway, breathing, and circulation. You should first establish a patient's responsiveness by asking, "Are you okay?" If the patient is unresponsive, the medical assistant must determine if the patient is conscious. The next step would be to activate the emergency response system by calling 911. Check the carotid pulse and if present, continue rescue breathing 10 to 12 breaths per minute. To open the airway, the patient should be places on the back, the head tilted and the chin lifted. PPE supplies for CPR include disposable gloves and CPR ventilator mask. During CPR, fingers are placed at the point where the sternum and the ribs join. Adult compression ratio 32 to both 1 and 2 man hands with 2 hands. Children compression ratio 32 to both 1 and 2 man hands with 1 hand. Infants compression ratio 15 to 2 man hands with 2 fingers. In CPR, the depth of a compression should be for adults 1.5 to 2 inches. In CPR, the depth of a compression should be for children 1 to 1.5 inches. In CPR, the depth of a compression should be for infants 1/2 to 1 inch. When preparing envelopes, one should use capital letters in block format. Telephone calls should be answered no later than the 3rd ring. A patient fails to keep an appointment. The medical assistant should make a note on the patient's chart. A backup tape for a computer is used to copy hard drive information. Which name would be filed first in an alphabetic filing system? Wilson Babcock. CPT codes are used to identify a medical procedure. ICD-9 codes are used to identify a medical diagnosis. Patient insurance cards should be reviewed at each visit. An HMO is an example of what kind of healthcare managed. A good tool for reminding staff when certain things need to be done is called a tickler file. Information may be sent rapidly by using a fax machine. The process of arranging a series of printed pages is called collating. The most important part of preparing correspondence. Proofreading. A daily log should be kept of all incoming telephone calls. Incoming mail should be sorted and date stamped. The preferred way to send valuable items by mail. Registered mail. Termination of care letters should be sent by certified mail, return receipt. System for leaving messages which can be retrieved later is voicemail. Cancelled appointments should be noted in the patient's chart. A method of maximizing appointment time is way scheduling. The appointment schedule can be used as a legal record. A useful telephone service for a physician with two office. Call forwarding. On a multi-line telephone, the line in use will be indicated by steady light. To best utilize the appointment schedule, set aside time for callbacks. An important way to make the patient feel comfortable. Warm greeting. Missed appointments can be reduced by calls to confirm appointments. Patients should be notified of any unusual delays. Having the patient's chart at hand is necessary when scheduling procedures. First come first serve method of appointment scheduling. Open hours. Stating names within another patient's hearing could be breach of confidentiality. The physical equipment of a computer is called hardware. Computer hardware with permanent memory. Hard disk. A portable memory storage device is called a floppy disk. Important procedure for protecting hard disk information. Backing up. The term used for starting the computer. Boot. Flashing line showing where data can be entered. Cursor. The most common device for data input. Keyboard. Word processing allows the user to quickly move or delete blocks of text. A convenient feature used when proofreading a document. Spell check. Large group of files used for information retrieval is database. All medical office should have a security policy to protect patient information. Computerized patient accounts, simply monthly statements and insurance billing. Computer scheduling allows quick access to open appointments. This list can be easily prepared with computer scheduling. Daily appointments. A computer field contains a piece of information. Software program that quickly calculates numbers. Spreadsheet. Rearrangement of information in a database is called sorting. Setting margins and tabs for a letter is called formatting. No office should download information from the internet without a anti-virus program. A method of controlling access to confidential patient information. Passwords. Progress notes are usually filed in what order? Chronological. The medical record belongs to the physician. The document stating patient agrees to a procedure. Consent. A method which speeds the filing process. Color coding. The term for removing inactive records from the files. Purging. Chart notations require the date, information and initials. Material which should never be used to correct medical records. Whiteout. Person who can legally sign a release of medical records. Patient or guardian. A system of organizing information in a medical record. SOAP. Medical charts are usually filed in which order? Alphabetical. Each page of the medical record should include patient's name and date. Information in the medical record is private and confidential. Records for patients currently receiving treatment are in the active files. Chart notes should be complete daily. Each patient is assigned a number in this system. Numerical filing. A patient must sign this document to obtain past records. Records release form. Which of the following names would be filed first? Pittman, Phillips, Pham, or Phipps? Pham. Which of the following names would be filed last? Larson, Lamar, Lai, or Larson? Larson. Which of the following numbers would be filed first? 073-91, 036689, 157,623, or 064942, 36,689. A fund used for small office purchases is called petty cash. A term for overpayment on an account is a credit. Monthly fee for bank account is a service charge. What is an encounter form? Pre-printed statement listing codes for basic office charges. What is a POST? Entering charges and payments to a patient's account. What is agging schedule? List of unpaid accounts by date of service. What is debit? Another term for charge. What are adjustments? Correction to a patient's account. What is indersing? Placing practice name and account number on the back of the check. What are accounts payable? Total of bills owed by the practice. What are accounts receivable? Total of all patients' accounts. Who can you never accept a payment from? A patient who has been turned over to a collection agency. What is a deductible? Portion of bill patient is required to pay each year. What is a write-off, cancellation of, and unpaid debt? What is a copayment? Amount patient must pay for each office visit. What is Medicare, federal insurance program for elderly persons or persons with permanent disabilities? What is a crossover, term for an insurance claim for a Medicare and medical patient? What is workers' compensation? Type of insurance for work-related injuries. What is a paper claim? Insurance claims which have greater chance for rejection. What is a modifier? Aide onto a procedure code which indicates special circumstances. What is Medigap? A policy which supplements Medicare coverage. What is Tricare? Champus, insurance coverage for military dependents. What is CMS 150? The universal claim form. An insurance claim with incomplete information will be rejected. What is capitation? Monthly fee a provider is paid for each covered patient. What is explanation of benefits? Insurance company statement of how a claim is settled. What is fraud? Billing services the physician did not perform. A procedure code followed by the modifier -99 indicates multiple modifiers. What are electronic claims? Insurance claims which shorten the payment cycle. What is a clean claim? Term for an insurance form that has been filled out correctly. When should a patient's addresses and billing information be updated? Each visit. Insurance claims require a patient to sign what to release information. Authorization. An assignment of benefits form allows the insurance company to pay the provider. What is HIPAA? Federal law protecting privacy of health insurance information. What are HCPCS codes? Medicare supplement to the CPT procedure codes.